Hi, it's Dr. Marc Legere here, and today I want to talk to you about the Vertiball and your low back. The Vertiball is something that I recommend for a lot of my patients who are suffering from low back pain and discomfort because it's so easy to use, it's effective at targeting some of those hard to reach muscles, and it's really effective for that at-home care. So let me show you how it works. Let me show you how to set it up, what muscles we're working with, and some exercises that you can try on your own. First, to get it open, we're just going to press down on this button and release the Vertiball from the wall mount. We're simply going to pull the tab down. That's going to allow you to attach it, so I want to have it in about my low back area. And then all you're going to do is you're going to press the clasp back, and then you're going to slide the unit right on back down onto it. So there we go. So now it's going to be nice and firm and snug onto the wall. It can be used on most surfaces, even painted drywall or glass. You just can't put it on anything that has texture to it because it needs to have this nice solid lock into it. So when we're talking about where we're going to be using it today, let me show you on our spine model. What we're going to talk about today is in this low back section, specifically what's called the lumbar spine. So the lumbar spine is composed of 5 vertebrae, so we can go 5, 4, 3, 2, 1. So these 5 vertebrae are going to be making up the area that a lot of people have trouble with. Specifically, we're going to talk today about how to use the Vertiball on the muscles that sit just on the side of the spine and to the muscles to the side of those. So the muscles that sit right on the side of the spine, those are going to be called the multifidus, and the ones that sit just to the side are going to be called the quadratus lumborum. Now, in order to be able to effectively work on the muscles, we need to know what they do, because the best way that I like the Vertiball to be used is when the muscles are in a stretched position. So if the multifidus, or these side muscles, when they contract, they're going to create extension of the low back, because when they're compressing or pulling, they're going to create an arch in the low back. And we're looking from back to front here. The QL is going to sit, or the quadratus lumborum is going to sit on the side of the spine. And when it contracts, for instance, on this right side, the back is going to bend towards that side. So when we go to work and release or roll out the multifidus, we want to try to create some flexion in the low back, or bending forward. And we go to work the right side, quadratus lumborum, we want to bend away from the side that we're working. So when we have the Vertiball set up here, all we're going to do is we're going to try to round out or flatten out the low back. That's going to get that tension into those muscles. And then we're simply going to go up and down, in and around on those muscles. And that should give you some pretty good relief. You can adjust how high or how low you want to go based upon how far you bend down or where the Vertiball is actually attached into the wall. When we're talking about the QL, again, when it contracts, it's going to bend to this side. So this would be my left QL. So to stretch out the QL, we want to bend away from the wall, or bend away from the Vertiball, and then we're going to kind of come in from the side. So you can kind of come up and bend to the side, and then it's almost like the ball is coming directly in just below the ribs but above the hips. And so from there, we're going to side bend, and then we're going to work the Vertiball up and down into those tender areas. Once we're done with using the Vertiball, if we want to try some things at home or things that you can do throughout the day, we want to again remember what the muscles do when they're shortened, and then we want to lengthen them. So for people who are familiar with some of those yoga poses, or specifically child's pose in yoga, it's a rounding out of the back forward. So if we want to get some better range of motion in the multifidus, work on bending or coming in this direction, which will create some stretching into this area. When it comes for the QL, because again it's bending to the side here, one of the exercises I usually recommend is taking the back leg and kind of bending it to the side, and then taking your arm on that same side and taking it up and away. In essence, pushing my hips to the left and taking my rest of my body to the other side. I recommend these for anybody who has that low back tenderness, tightness, or discomfort. It's something that I'd say usually to start off 1 time a day, but as you get better at it, you can add more time and more frequency to help you get you some relief in those low back areas. So take a look, Hopefully it's something that you'll find as effective as I do when it comes to taking a look at your low back. Have a great day.